Welcome back, friends, to TV5 News at 9. Joining us this morning is Dr. Brian Ye. Thank you so much for being here, Doctor. How are you?
I'm doing well. Thank you for having me.
Of course. We're so glad that you're here. Today we are talking, viewers, about proton therapy and brain cancer. So, Doctor, what are the common types of brain cancer?
So actually, the most common type of brain cancer is what we call metastatic brain cancer. It's cancer that starts in another part of the body and travels to the brain. There are other types of brain cancers that occur in the brain primarily, or that's where they start. One is called meningioma. That's a benign brain tumor. Another one is called a glioma. Gliomas are aggressive, malignant brain tumors. Common forms are one called, for example, glioblastoma. Glioblastoma has been in the news recently. That's the brain tumor that President Biden's son, Beau, had, as well as Senators Ted Kennedy, as well as John McCain. So glioblastoma has sort of been in the news recently because of that. Right. Glioblastoma is the most common malignant brain tumor, but it's not the most common brain tumor. Metastatic tumors from other parts of the body, as well as meningioma, are more common.
And doctor, what causes these types of cancer?
Metastatic brain cancer is cancer that starts in another part of the body and travels to the brain. So unfortunately, a risk factor for any type of cancer, whether it be lung cancer, or breast cancer, those are common cancers that happen in men and women. Those can spread to the brain. Meningiomas, are typically associated with either prior brain trauma. For example, people who've been in a car accident sometimes are at increased risk of getting meningiomas, as well as exposure to radiation or exposure to estrogen. For meningiomas, for glioblastomas, we don't know exactly what causes them. We do think there are certain genetic syndromes that can cause them. For example, there's something called Lynch syndrome or Li-Fraumeni syndrome. Unfortunately, also exposure to radiation can also cause glioblastoma.
Wow. So, doctor, why might proton therapy be a good treatment option for these cancers?
So, proton therapy is a more focused type of radiation therapy. The conventional radiation therapy uses X-rays, and so X-rays go through your body, so it's not as focused. Protons are more focused. I have a picture, if I can share it. It's a comparison of an X-ray therapy plan, which is conventional radiation therapy, compared to proton therapy. So this here is, on the top is a patient, actually it's the same patient, this is the patient who's treated with proton therapy. But on the top, we actually created an X-ray plan to just show what an X-ray plan would look like. On the bottom is a proton plan. And the lines correspond to equivalent doses. They're not exactly the same color because we use different software to calculate X-ray plans versus proton plans, but the colors are sort of similar. So you can see here, this blue line, which is the lowest dose of radiation, extends much more to the other side of the brain. So this is a patient with a brain tumor right here, sort of on the, in medical imaging, everything's flipped left and right, so this is actually the left side of the brain. And you can see here, there's a lot more radiation going to the other side of the brain, to the right side of the brain, as compared to proton therapy. Here, this is on the bottom, this is the patient being treated with proton therapy, so the radiation is a lot more condensed, it's a lot more compact. There's almost no radiation going to the other side of the brain. This is important because actually radiation dose can affect cognitive function. We do know that patients have short-term memory difficulty after radiation therapy, especially if more of the brain has gotten radiation therapy. And also children are very sensitive to radiation to the brain if they haven't reached puberty yet. And this can affect their cognitive functioning later in life, their ability to go to college, and so on. So proton therapy is a better treatment for patients with brain tumors.
Yeah, it's very targeted therapy. Thank you, doctor, for sharing that with us. So how can patients find out if proton therapy is right for them?
So the best way is to give us a call at 1-855-MY-PROTON, that's spelled MYPROTON, or they can go to our website, McLaren.org/proton treatment.
Awesome. Thank you, doctor. Anything else that you'd like to share with us today?
No, just have any questions, please feel free to give us a call. We are here. I mean, unfortunately, every patient's situation is different, so it's hard to sort of give general advice, but I'm always available to speak with people who are interested in proton therapy, so please just reach out and give us a call.
We love to hear that. Thank you, doctor, for taking some time out of your busy schedule to call in today. We appreciate you.
Thank you for having me.
Of course, you're so welcome. And you can find more information in the hot link section at WNEM.com.